We have a 13-year-old swimmer who presents with left shoulder pain while he is swimming freestyle. We know that the shoulder is connected to the opposite hip through the diagonal muscle sling from the left lats through the thoracolumbar fascia and into the right glute. And this connection and the stability of the hips are crucial for efficient biomechanics in swimming. The hip muscles are the major drivers of rotational movement and propulsion. If there's weakness and instability in the hips, the shoulder will then have to pick up the slack. But the shoulder muscles are much smaller and will have to work much harder to produce the same amount of force as the hips, resulting in what this patient is experiencing, which is strain and overuse of his shoulder. In his 3D movement scan, we can clearly see instability in his right hip and how it affects his trunk stability and shoulder mechanics, confirming the importance of looking along the full kinetic chain beyond the site of pain and injury. We need to look at the whole body and treat dysfunctional movement patterns. Proper hip activation is necessary for this patient to restore his functional movement and address the underlying cause of his shoulder pain. With this baseline information from the scan, we'll be able to treat and correct compensations efficiently and rescan to show improvements in his movement. After his first session where we activated his hips using Redcord Neurac therapy, we found that his shoulder pain has already significantly reduced.